Good evening, guys, or afternoon. This afternoon's topic is whole body cryotherapy. We're going to discuss that for today, so please join me in today's presentation I made. Sit back and enjoy, folks. Okay, give me a second to set up for the show, and I'll be right with you. Give me a minute. I'll put my gear on. Now, before I get today's presentation done, my outfit that I'm wearing tonight is in my aunt's honor. She's one of the reasons that I went and got all my degrees in elderly care. So I'm wearing my scrubs and stuff in her honor tonight. So, with that being said, this show is to be partly, um, partly as a tribute to her, and partly so everybody can see my 25-year jacket that I got. So with that being said, let's go. The video does whole body cryotherapy actually work? This is from a clinical physio offers an evidence-based review of this popular therapy. Whole body cryotherapy, or WBC, involves exposing the body to extremely cold temperatures, often below minus 100 Celsius, for a few minutes, with claims that it enhances recovery, reduces inflammation, and improves performance. According to the video, the expert physio examines current scientific literature to assess whether these claims are supported. The key takeaway is that while WBC may offer some short-term benefits, such as a perceived reduction in muscle soreness post-exercise, the clinical evidence remains limited and often inconsistent. The video likely points out that WBC is not a give me a minute, guys, replacement for proven recovery strategies, and that results vary widely between individuals. If you're evaluating its use for sports recovery, pain management, or general wellness. It's wise to approach with cautious optimism. Let me know if you'd like a deeper dive into the psychology, physiology behind WBC or the specific studies cited in the video. Cryotherapy triggers a cascade of physiological responses, many of which are rooted in the body's reaction to extreme cold. Here's a breakdown of key effects. Okay, number one, uh, vascular constriction and vasodilation. Lewis Huntington uh, reaction. Initially, blood vessels constrict to preserve core temperature. After prolonged exposure, they may dilate and intermittently to prevent tissue damage. A cycle known as the Lewis reaction. Reduced nerve conduction velocity. Hold on. I'll be right back. Cold slows down the transmission of nerve signals, which can help reduce pain perception and muscle spasticity, decrease inflammation and edema. Cryotherapy can reduce local blood flow and cellular metabolism, which may help limit swelling and inflammatory responses after injury. Muscle relaxation and reduced spasm. By dampening nerve activity and lowering tissue temperature, cryotherapy can ease muscle spasms and improve comfort. Lowered intermuscular temperature. This helps slow down metabolic processes in tissues, potentially limiting secondary tissue damage post injury. Analgesic effects. The cold induces a numbing sensation, offering temporary pain relief, especially useful in acute injuries or chronic pain conditions like arthritis. Valuable effects on cardiovascular and reflex responses. Some studies show consistent changes in heart rates, blood pressure, and reflex activity, suggesting individuals' variability in response. If you're curious about how these effects differ between a localized and whole body, cryotherapy, or how it might be applied to specific conditions like RA or post exercise recovery, I'd be happy to explore that with you. Cryotherapy, especially whole body cryotherapy, WBC, can offer some benefits, but it is not without risks. Here is a breakdown of potential side effects, ranging from mild to severe to more serious. Common and mild side effects: headache, dizziness, or nausea, often due to sudden exposure to extreme cold or changes in blood pressure. Skin irritation or rash. Cold exposure can trigger redness, itching, or even cold induced hives. Temporary numbness or tingling, especially if superficial nerves superficial nerves are affected. Moderate to severe risks: frostbite or burns. Prolonged or improper exposure can damage skin and underlying tissues. There have been reports of third-degree burns from cryotherapy chambers. Cold pancreatitis, a rare inflammatory condition where fat cells are damaged by cold, leading to painful itchy rashes, respiratory infections, or bronchospasms, particularly in individuals with asthma or other respiratory conditions. Systematic effects: changes in blood pressure or heart rates. Cryotherapy can cause spikes in blood pressure or bradycardia, slowed heart rate, which may be risky for people with cardiovascular conditions. Infection risk for localized cryotherapy, especially if the skin barrier is broken or blistered from post treatment. These effects are not guaranteed. They underscore the importance of proper technique, supervision, and screening, especially for people with underlying health conditions. If you're considering B, C for recovery or chronic pain, it's worth weighing these risks against the limited and variable evidence of benefits. Would you like to explore how these risks compare to other recovery methods like contrast baths or compression therapy? Cryotherapy, whether localized or whole body, offers a range of potential benefits through the strength of evidence, though the strength of evidence varies depending on the application. Here's a here is a breakdown of the most commonly reported advantages. Pain relief and muscle recovery. Cold exposure can reduce nerve conduction, uh, velocity, and inflammation, which may help relieve pain and accelerate recovery after intense physical activity. Athletes often use it to manage delayed onset muscle soreness or DOMS, reduced inflammation. Give me 1 second. Okay. Next page. Cryotherapy may suppress pro-inflammatory cryo tokens and promote anti-inflammatory responses. This can be helpful in managing conditions like arthritis or post-injury swelling. Improved mood and mental health. Whole body cryotherapy has been linked to increased release of endorphins, uh, and some studies suggest it may help alleviate symptoms of depression and anxiety, though more research is needed. 4. Enhanced sleep quality. Some users report better sleep following WBC sessions, possibly due to reduced pain and improved mood regulation. 5. Support for skin conditions. Localized cryotherapy used to treat warts, skin tags in certain precancerous lesions, and may also improve skin tone and reduce puffiness by constricting blood vessels. 6. Potential metabolic and cardiovascular effects. Preliminary research suggests cryotherapy might improve lipid profiles, e.g., lowering uh, cholesterol and triglycerides, and enhance antioxidant capacity through these findings, though these findings are still under investigation. Okay, 7. Adjunctive use in cancer treatments. Targeted cryoabrasion is used in oncology to destroy abnormal tissues in early stage cancers like prostate, liver, and skin cancers. This this distinct from WBC and its medical procedure performed under clinical supervision. While many of these benefits are promising, it's important to note that whole body cryotherapy is not FDA approved. For most of these users, and the evidence base is still evolving. If you're considering it for a specific condition like RA, chronic pain, or post exercise recovery, I'd be happy to help you weigh it against other uh, uh, modalities like contrast cryotherapy, especially in the whole body form, can pose several risks, particularly uh, when not administered properly or when used by individuals with underlying health conditions. Here's a concise overview of the potential hazards. Skin and tissue damage. Frostbite is most commonly reported injury, especially if protective gear isn't used or exposure is too long. Burns or blisters can occur from direct contact with cryogenic gases or surfaces. Cold peritonitis, a rare inflammatory reaction in fat tissue, may cause painful nodules or rashes. Cardiovascular and respiratory effects. Sudden cold exposure can lead to elevated blood pressure, bradycardia, slow heart rate, or arrhythmia, posing risks for those with heart conditions. Individuals with asthma or respiratory sensitivities may experience bronchial spasm or breathing difficulties, neural, uh, neurological, and systematic reactions. Some users
We are unavailable to take your call. Please leave a message. Thank you for calling.
Some users report dizziness, nausea, or headaches, likely due to vascular constriction or altered blood flow. In rare cases, loss of consciousness has been reported, particularly in unsupervised or poorly ventilated cryo chambers. Infection risks, localized cryotherapy when used on broken skin or post surgical sites. Cryotherapy can increase the risk of infection or delayed healing. Regulatory and safety concerns. Well, whole body cryotherapy is not FDA approved for treating medical conditions, and oversight varies widely across facilities. While people tolerate cryotherapy well, these risks highlight the importance of medical screening, proper technique, and professional supervision. If you're considering it for specific conditions like arthritis, post exercise recovery, or mood support, I'm happy to help you compare it with safer or more evidence backed alternatives. So that is A for you. I will be back on shortly with B. Give me a bit for B, please.